As we age, our bodies go through many changes, and one area that often reveals important health information is our voice. While it might be easy to dismiss certain changes in our voice as just signs of getting older, some shifts in how we speak can actually be a warning sign of underlying health problems. In this video, we're going to dive into 7 subtle changes in your voice that could indicate serious health issues. These signs might not seem urgent at first, but they could be linked to heart conditions, neurological diseases, respiratory problems, and more. Ignoring these voice changes could lead to more severe complications down the line. Let's take a closer look at each of these subtle voice signs, what they might mean, and why you should pay attention to them, because your voice could be telling you something important about your health. Number 1, hoarseness or a raspy voice, persistent. A hoarse or raspy voice is one of the most common and noticeable changes that can happen to your voice. While it can be temporary and caused by factors like a cold, allergies, or overuse of the voice, when hoarseness persists for more than 2 weeks, it could be a sign of a more serious underlying health issue. In seniors especially, persistent hoarseness should not be ignored, as it can be a signal of a deeper condition that may require medical attention. The most common cause of a persistent hoarse voice is laryngitis, which occurs when the vocal cords become inflamed, usually due to infection or irritation. However, if the hoarseness lingers for weeks or longer, it could be indicative of more serious conditions, including thyroid problems. Conditions like hypothyroidism or thyroid tumors can lead to changes in the voice. The thyroid gland, which sits near the vocal cords, plays an essential role in regulating metabolism, and an underactive thyroid, hypothyroidism, can cause a low, raspy voice. Vocal cord nodules or polyps. These are growths that form on the vocal cords due to excessive strain or use of the voice. They can cause persistent hoarseness and difficulty speaking. Teachers, singers, and public speakers are often at risk, but anyone can develop these growths. Gastroesophageal reflux disease, GERD. Chronic acid reflux can cause acid from the stomach to reach the throat and vocal cords, leading to irritation, inflammation, and hoarseness. This can also cause other symptoms like heartburn and regurgitation. Lung or throat cancer. In rare cases, a persistent hoarse voice can be a warning sign of cancer, particularly in the larynx, voice box, or lungs. If the hoarseness is accompanied by difficulty swallowing, unexplained weight loss, or persistent cough, it's crucial to seek medical attention immediately. If you or a loved one experience a hoarse voice that lasts for more than 2 weeks, it's essential to see a doctor for a proper diagnosis. A healthcare provider may perform a laryngoscopy, a procedure to look at the vocal cords, to assess the cause of the hoarseness. Depending on the diagnosis, the treatment could involve resting the voice, medication, or even surgery if necessary. Number 2, sudden changes in pitch or tone. A sudden change in pitch or tone of your voice is one of the more alarming signs that should not be ignored. If you notice that your voice sounds higher or lower than usual, it could indicate that something more serious is happening in your body. A change in pitch could signal a variety of health issues, ranging from nerve damage to neurological conditions like Parkinson's disease or stroke. One common cause of a sudden change in voice pitch is vocal cord dysfunction, which can occur when the vocal cords don't close properly during speech. This condition can be caused by a variety of factors, including stress, overuse of the voice, or more serious issues like nerve damage. A sudden change in pitch or tone can also be a sign of neurological disorders such as Parkinson's disease or stroke. In Parkinson's disease, the neurological damage affects the muscles responsible for controlling the voice, leading to monotone speech or an unusually soft voice. This is known as hypophonia, which is a hallmark symptom of Parkinson's disease. Parkinson's disease can also cause rigidity in the muscles around the throat and larynx, which alters the pitch and tone of the voice. A stroke can also cause sudden changes in pitch or tone, particularly if it affects the area of the brain responsible for speech and vocal control. If a stroke occurs in the left hemisphere of the brain, it can cause dysphonia, or difficulty speaking. This condition can lead to a weak, strained, or high-pitched voice. If this symptom occurs suddenly, along with other stroke-related signs like numbness, difficulty with movement, or vision changes, seek immediate medical attention. If you experience a sudden change in pitch or tone that lasts for more than a few days, it's crucial to seek medical attention. Early diagnosis is key to managing potential underlying conditions like Parkinson's disease, stroke, or vocal cord issues. A doctor may perform a laryngoscopy or neurological tests to determine the exact cause and recommend appropriate treatment. Number 3, weak voice or difficulty speaking. A weak voice or difficulty speaking is a common problem for many seniors, and it can be caused by a variety of factors. While occasional hoarseness or a tired voice can happen after a long day of talking, if you experience a weak voice or difficulty speaking regularly, it may indicate a more serious underlying issue. When your voice lacks strength, it can affect not only communication, but also your overall quality of life. A weak voice can be a sign of muscle weakness, particularly in the muscles responsible for speech. As we age, the muscles around the vocal cords may become weaker and less efficient, leading to difficulty projecting the voice. This condition, known as presbyphonia, is often associated with the natural aging process and is common in older adults. Another potential cause of a weak voice is neurological issues. Conditions such as Parkinson's disease or multiple sclerosis, MS, can affect the muscles that control the voice, making it harder to speak clearly or with enough force. In Parkinson's disease, the voice often becomes soft, monotone, and difficult to hear, a symptom known as hypophonia. MS can affect the nerves controlling vocal cord movement, leading to a loss of voice strength. A more serious cause of a weak voice could be vocal cord paralysis, which occurs when one or both vocal cords become paralyzed, often due to nerve damage. This condition can cause a breathy voice, difficulty speaking, and a sensation of tightness in the throat. Vocal cord paralysis can result from conditions like stroke, tumors, or surgical complications. If not addressed, this condition can severely affect the ability to speak and breathe properly. If you or a loved one notice that your voice has become consistently weak or that speaking has become more difficult, it's important to consult a doctor or an ear, nose, and throat EN specialist. Early diagnosis is critical in identifying the underlying cause of voice weakness, whether it's due to muscle weakness, neurological conditions, or vocal cord problems. A speech therapist may also be helpful in strengthening vocal cords and improving breath control, which can greatly enhance the ability to speak clearly. In some cases, medical treatments such as surgery or voice therapy may be necessary to restore voice function. Number 4, breathy voice. A breathy voice is one that sounds airy or faint, as though the speaker is struggling to get enough air while speaking. If you notice your voice becoming breathier over time, it could be a sign of underlying health issues that may need immediate attention. While a breathy voice might seem like a minor inconvenience, it can indicate a serious condition affecting your respiratory system, vocal cords, or heart function. One of the primary causes of a breathy voice is vocal cord dysfunction. This occurs when the vocal cords do not close completely when speaking or breathing, leading to air escaping through the vocal cords. This issue can be caused by stress, overuse of the voice, or more serious underlying conditions such as vocal cord paralysis or neurological diseases. Another common cause is chronic respiratory diseases such as chronic obstructive pulmonary disease, COPD, or asthma. In both conditions, the airways are narrowed, making it difficult for air to flow freely, leading to a breathy, labored voice. Emphysema, a form of COPD, affects the lung tissue and reduces the ability to get enough air, further contributing to a breathy voice. Heart failure is another condition that can lead to difficulty breathing and a breathy voice, as it may cause fluid buildup in the lungs, making it harder to speak clearly without sounding winded. If you begin noticing a breathy voice that does not improve or seems to worsen over time, it's important to consult with a healthcare professional. A speech therapist or otolaryngologist ENT specialist can help determine the root cause of the breathiness and recommend appropriate treatments. If the breathy voice is related to a respiratory condition like asthma or COPD, treatment options may include medications to improve airflow, inhalers, and breathing exercises to help strengthen the respiratory system. For issues related to the vocal cords, such as vocal cord paralysis or dysfunction, treatment may involve speech therapy or surgical interventions to improve vocal cord movement. Number 5, slurred speech. Slurred speech is one of the most alarming changes in a person's voice, and it should never be ignored. When speech becomes mumbled or difficult to understand, it can signal a serious health condition that requires immediate medical attention. Slurred speech is often associated with neurological disorders or conditions that affect the brain and nervous system, including stroke, Parkinson's disease, and multiple sclerosis. One of the most common causes of slurred speech is stroke, particularly when it occurs in the areas of the brain that control the muscles needed for speech. A stroke can cause weakness or paralysis on one side of the face, which makes it difficult to form words properly. Along with slurred speech, other symptoms of a stroke may include facial drooping, difficulty moving one arm or leg, and numbness. If slurred speech occurs suddenly, seeking immediate medical help is essential. Another cause of slurred speech is Parkinson's disease, a neurodegenerative condition that affects the brain's ability to control voluntary movements. As Parkinson's progresses, it can lead to muscle stiffness, tremors, and a slowed voice. The speech of someone with Parkinson's often becomes more monotone and slurred as the muscles controlling the vocal cords and mouth become rigid. This is known as hypophonia, a hallmark symptom of Parkinson's disease. Multiple sclerosis, MS, another neurological disorder, can also cause slurred speech as it affects the nerves that control muscle movements. MS can cause fatigue, muscle weakness, and difficulty coordinating movements, leading to difficulty speaking clearly. If slurred speech occurs suddenly, it's crucial to seek immediate medical attention. Emergency services should be called if slurred speech is accompanied by other stroke symptoms, such as numbness, vision problems, or loss of coordination. Early intervention can reduce the risk of further complications and improve the likelihood of a full recovery. If the slurred speech is due to a chronic condition like Parkinson's or multiple sclerosis, speech therapy may be recommended to help strengthen the muscles needed for speech and improve communication skills. Additionally, medications or physical therapy might be prescribed to manage symptoms and prevent further progression of the disease. Number 6, monotone voice. A monotone voice, or a voice that lacks the usual pitch variation and expression, can be a subtle but significant indicator of underlying health issues, particularly when it develops gradually over time. Normally, our voices fluctuate in pitch depending on the mood, intensity, and emotional content of our speech. However, a monotone voice, a voice that sounds flat and lacks natural inflection, could signal a neurological issue, mental health condition, or even muscle dysfunction. One of the primary causes of a monotone voice is Parkinson's disease, a progressive neurological disorder that affects motor control. As the disease advances, the muscles responsible for speech, particularly the muscles around the larynx, voice box, become stiff and less responsive. This results in a speech pattern that lacks natural variation in pitch, known as hypophonia. People with Parkinson's often find that their voice becomes softer, say monotone, and harder to hear, which can interfere with their ability to communicate effectively. Additionally, depression and anxiety are associated with changes in speech. A flat tone or monotone voice is common among individuals dealing with depression, especially when they are feeling emotionally withdrawn or lack motivation. This can make the individual sound disinterested or disconnected, but the issue is often psychological, related to low energy or emotional numbness. In some cases, a monotone voice can also be a sign of neurological damage, particularly if there has been an injury to the brain or nervous system. For example, damage to the part of the brain that controls emotional expression or speech production may lead to difficulty modulating pitch and inflection. If you or someone you know begins speaking in a monotone voice, it's important to consult a healthcare provider to determine the underlying cause. For those with Parkinson's disease, speech therapy can be incredibly beneficial. Speech therapists can work with patients to help them strengthen vocal cords, improve articulation, and regain more natural pitch variation. For seniors who are experiencing depression or anxiety, seeking professional help from a therapist or counselor can help address the psychological cause of the monotone voice. Cognitive behavioral therapy, CBT, medication, and lifestyle changes, such as regular physical activity and social engagement, can help restore emotional balance and improve speech. Regardless of the underlying cause, early intervention is key to improving communication and preventing further complications related to speech. Number 7, Voice changes with swallowing difficulty. Voice changes that occur alongside difficulty swallowing or a sensation of food getting stuck in the throat should never be ignored. This can be an indication of underlying issues with the throat muscles, vocal cords, or nervous system. Difficulty swallowing, or dysphagia, is a condition often associated with various neurological or muscular disorders, and when combined with a change in voice quality, it signals that immediate attention is needed. One of the most common causes of voice changes with swallowing difficulty is stroke. A stroke that affects the part of the brain controlling swallowing or speech can lead to both dysphagia and dysphonia, changes in voice quality. After a stroke, individuals may find it difficult to control the muscles responsible for both swallowing and speaking, leading to voice hoarseness, a breathy voice, or slurred speech. Another potential cause of swallowing difficulty and voice changes is Parkinson's disease. As Parkinson's progresses, it can affect the muscles responsible for both swallowing and speaking, leading to a condition known as oropharyngeal dysphagia. In these cases, the muscles in the throat become weak and the prey may experience difficulty swallowing liquids or solids, along with voice changes such as a soft or weak voice. Gastroesophageal reflux disease, GERD, is also linked to swallowing difficulty and voice changes. Acid reflux can cause irritation and swelling of the vocal cords and throat muscles, leading to a raspy or hoarse voice. In some cases, the acid can make it harder to swallow as the esophagus becomes irritated and constricted. If you or a loved one experience voice changes along with swallowing difficulty, it is critical to seek medical attention immediately. A healthcare professional can perform a swallowing study or endoscopic examination to determine the underlying cause of these symptoms. Depending on the cause, treatment options may include speech therapy, medications to manage acid reflux, or physical therapy to strengthen the muscles involved in swallowing. In some cases, surgery may be necessary, especially if there is nerve damage or a blockage in the esophagus. Early diagnosis and treatment are essential to prevent complications such as aspiration pneumonia, which occurs when food or liquid enters the lungs due to swallowing difficulties. As we've discussed today, our voice can serve as a powerful indicator of our overall health. Even subtle changes in how we speak, whether it's hoarseness, slurred speech, or swallowing difficulty, can signal underlying issues that need immediate attention. It's important to understand that these changes are not just part of getting older. They could be a warning sign of something more serious, such as stroke, Parkinson's disease, vocal cord problems, or other neurological conditions. If you or a loved one are experiencing any of these voice changes, don't ignore them. It's crucial to seek medical advice and get checked by a healthcare professional, especially if the change is sudden or persists over time. Early detection and treatment are key to managing these conditions effectively and improving your quality of life. Remember, your voice is not just a means of communication, it's a reflection of your health. If you notice changes in how your voice sounds or feels, take it as an opportunity to address the underlying issue before it gets worse. Have you noticed any changes in your voice recently? What steps are you taking to care for your vocal health? Let us know in the comments below. If this video helped you or someone you care about, don't forget to like, subscribe, and share it with others. Let's keep spreading the message about taking care of our voices and our health. Stay healthy, stay informed, and stay wise with true senior wisdom.